In this particular patient, she has elected regenerative technology. Now, that's not necessarily something that every patient needs, wants, but there is decent level evidence to suggest that it can help with tendinopathy and rotator cuff healing. So in this case, we are going to be applying PRP, regenerative technology, in the area of the shoulder around a significantly frayed shoulder where a repair is done, or even if it's a significant partial tendon repair, which didn't require a repair, but it's a partial tendon debridement where we want some growth factors in that area to reduce pain and hopefully promote some degree of healing from a pain perspective and regeneration. Here you go. We're always doing the blood draw initially, and so once we get it started, then we just simply draw the blood. And in this particular patient, as we discussed, in the PRP part of the procedure, we're drawing the blood, and the goal is to draw the blood at about 1 cc per second. You don't want to shear the blood vessels, the blood cells, and you want to maintain the integrity of the cells because you want to get as many growth factors within the blood concentrate as you can. So as you can see, the patient's asleep, and we're drawing the blood here. Sometimes we do this in the office or prior to the procedure. In this particular case, we're doing it in the OR so the patient doesn't feel anything. And then I'll show you the rest of the PRP preparation shortly. Once we have the blood drawn, we basically have it right here. Okay, and then we're taking this and we're placing it into the chamber. This particular PRP preparation is the M site, and you'll probably see this a lot. It is my preferred PRP kit. There are many options out there, and every one has its advantages and disadvantages. This is simply the one that I like to use. And we're transferring the blood again into this chamber. And again, we don't want to shear the blood vessels, so we go slowly into this. And then once we have it all in there, we remove this, okay? And we give this area a wipe. Okay. All right, so then we take this to the chamber. Okay. All right, so the chamber goes into this. There's a column of saline. It balances this out. And we have a lot of different options. We've pretty well, the goal is this is going to be the tendon-specific PRP. So we're going to have 2 spins in this. And you'll see clips of the video with the different components of the spin as we run it through. And we're then going to take this sterilely when we're doing the actual injection, and you'll see that later. All right. Okay, perfect. Okay, so now that we did the first spin, this is what we have. And what we want to do is we want to minimize the red cells in this to get pure PRP in this particular case. And so what we're going to do is we're basically just going to extract the very top of this. So we clean this off because this was just in that kit. This is a fresh sterile syringe. Okay. So in this particular case, you have the separation where the red cells are on the bottom, and then you've got a buffy coat with the growth factors and serum. So what we initially want to do is we want to extract most of the plasma off, and then we get the good stuff. And then we spin it again to get the pure PRP. So now what we're doing is we're basically just extracting the upper layer of plasma, okay? And then we want to get right down to the point where we have this area between the 2 layers. Maybe a little bit more. How's that? So we go all the way down. And we want to avoid taking any of the blood. So once we see the flash of blood come up, that's when we stop, okay? So now we're transferring this, okay, into our second spin. And this is where we separate out the PRP components even more to get what's called a pure PRP. Okay, perfect. Okay, good. So now we got these balanced in. We basically now close the lid, and then we start it again. And it's already set, and we start. So what we're doing now is we're basically drawing off that pure PRP. First we have to draw off what we don't need. There's residual plasma and serum, and then we're going to be left with our the good stuff, okay? So now we've drawn off what we don't need, and then we're going to mix it all up. This has all the growth factors in there. Okay, so now we slowly draw up all the pure PRP. We're going to maximize as much as we can. Okay, perfect. All right, good. So that is the pure PRP that we have. We're just getting rid of the air bubbles, and then we're good. Okay. All right, so now we have a dry scope in, so we have no fluid in there. We're making a watertight seal, essentially. We have our needle where we want it, and the scope is actually in a posterior portal that has a suture in it. And so we basically want to go in there, and then we inject this area, and as we start injecting, the scope basically comes out and we confirm our seal. Okay, good. Perfect. All right, awesome. Once the cuff was repaired, as you saw, the PRP was prepared throughout the case. We drew the blood initially prior to starting, then it was prepared on the back table while we were setting up, and then we completed the preparation at the end, and you'll see this in one segment. And then once the cuff was repaired and we basically sutured all the wounds, we basically put our scope back in dry, which means there was no fluid in there, with our sutures cinched up tight to maintain watertight closure. And then we inserted our needle, confirmed our needle placement. We placed it in, put the needle underneath the cuff repair, intra-articularly, and then on top of the cuff, and then we did our repair. Hope you enjoyed it. Thank you.